Hi, everybody. How are you? This is so impromptu. So I know there's not a lot of people. I didn't actually pre I didn't actually like advertise this at all. So if you're here, thanks for coming. I see only one person. If you want to chat, ask some questions, go right ahead. I am here to chat and answer your questions. So today is October 13th, and actually my birthday is coming up. So I'm going away to spend some time with family and friends. And so I will not be releasing a video tomorrow. So instead, a meeting of mine got canceled. I thought I'd come on live and spend some time with you guys. So thanks so much for joining me. I really appreciate it. Oh my God, from India. Thank you guys so much for coming. I'm doing great and really just feeling wonderful today and blessed to have to just be here and be able to service you guys and give you guys education. I'm working on some really great videos coming up for next week, so I hope you guys are ready to enjoy them. Thank you guys so much for all the wonderful things. Please ask your questions. I'm so happy to answer them. Anything you guys want to learn about urology. So there's a question here, is urology both clinical and surgery? So urology is absolutely both clinical and surgery. Thank you. Thank you for everyone saying hello and happy birthday. So as a urologist, we take care of both the medical and surgical issues that go along with the genitourinary tract. So that includes the kidneys, the tubes that drain the kidneys, and the bladder itself. And so with those, you can have problems like kidney stones and bladder tumors and cancers and things that need surgical management. But also we do a lot of medical management. So things like overactive bladder and BPH, while we have surgical options, we also manage them medically. And BPH is an enlarged prostate. So hopefully that helps. We do both surgery and medicine, and it's probably the best field in medicine. Of course, I'm biased, but I love it. I love my colleagues, and I'm really blessed to be a urologist and work with such great people. Let's see, what do we got here? Postvoid dribbling. So postvoid dribble, I have a great video about this where I go over all the causes of postvoid dribble, and there are many. So there's not something specific that you can do. First, you want to get evaluated to see if you have an issue with your prostate that might be blocking, or a stricture that could be blocking the urinary stream. Also, of course, you can try and jiggle, or you can push a little bit on the perineum, where sometimes urine can get caught, which is the area between the scrotum and the anus, and that sometimes can help get some urine out so you don't have so much postvoid dribble. So I have a question here about foreskin cracking during intercourse. And so that is actually not normal. You may be having some issues with your foreskin, which could be causing cracking. So I would definitely get evaluated by a urologist to see if either some sort of topical ointment or surgery would be helpful in your case. Okay. So there's a question about semen production. And so I've made a video about that. Make sure you check it out. But basically, semen is produced. There's parts of semen that are made from the testicle, which releases sperm. Then there's also parts that are made from the prostate and from the seminal vesicles. And essentially, they all come together and they are released through the ejaculatory duct into the P tube. And so when you get aroused, that kind of stimulates ejaculation to take place. Through the spinal cord. It's kind of a reflex. And so when you feel it, it will actually release, and the contents of it include things like fructose and different proteins and different minerals, all to kind of optimize sperm health and to optimize sperm movement in the vagina for eventual reproduction. Okay, so let's see. Okay. What does the prevalence of UTIs in the elderly lead to? Why does the prevalence of UTIs in the elderly lead to periods of confusion or delirium? That's a great question. So urinary tract infections are infections of the bladder, usually by bacteria. And usually these present with symptoms like needing to urinate frequently, urgency, having pain when you urinate, or pain in the lower part of the abdomen or the suprapubic area. And so In most people, those are the symptoms you'll see. Sometimes you'll have a fever. In elderly patients, sometimes you'll see them get very, very confused. And, the reason we think this happens is that essentially when you're older, little things, the barrier between the brain and the body get weakened over time. And so things that would normally just affect your body and remain close to your body can actually affect your brain as well and make you have more issues with confusion and delirium. And so that is common. It can happen in elderly patients where when you get an infection, you get confused. So if you are elderly or you have family that's elderly and they get confused, make sure you take them to the doctor and have them evaluated for the possibility of a urinary tract infection. Okay. Can pre-ejaculate cause pregnancy? So that's a very good question. In fact, pre-ejaculate or pre-cum is essentially a little bit of fluid that's released prior to the formal ejaculation. It is involuntary, meaning you cannot control it. It doesn't have sperm in the pre-ejaculate. But if you have ejaculated recently and it's not all cleared from the urethra, then the remaining sperm that are in the urethra can come out with the pre-ejaculate. So while you can't get pregnant with pre-cum, if it was just that, you can't guarantee that there might not be some viable sperm still in the actual urethra itself. All right, let's see what else. Okay, so there's a question here. If I have an erection by myself, it's good, but it's difficulties with my girlfriend. So that's a really great topic. And in fact, I have a video coming up about that. So make sure you subscribe, turn on the notifications so that you see that video when it comes out. But essentially what happens is when you're by yourself, there's less expectations. There's no issues with like what with what you're supposed to do, how you're supposed to perform. And so sometimes because of those reasons, you can perform much better than you can with your partner. Also, if you are doing certain activities, in fact, this was the video I recently released, if there's certain activities you're doing, like you're having, using very firm pressure, like the death grip, so to speak, or you're using certain fantasies, certain toys, that can actually affect your ability to perform when you're with a partner, because your partner can't like do those exact same things necessarily during penetrative sex. The vagina, the mouth, or hands may not reciprocate or replicate those things that you're doing by yourself. So retrograde ejaculation, I get asked this question a lot. I need to make a video on this, so thank you for bringing it up. Retrograde ejaculation is essentially when you ejaculate, but instead of the ejaculate coming forward and out like it normally does, it goes backwards into the bladder. And so this often happens after you've had any sort of prostate surgery or prostate removal. And so in those cases, it is not reversible because the actual mechanism that typically keeps forces the ejaculate forward is no longer there. However, if some people can have it from bad diabetes or other medical problems, and sometimes there are things we can try, like using certain medications right before intercourse to see if that helps the ejaculate move forward. So see your doctor and see if they can prescribe you some of those medications to see if that helps with your retrograde ejaculation. Can a couple get a STI even if neither of them have had oral or penetrative? I'm assuming that's oral or regular intercourse. No, if you've never had any exposure to oral, anal, or vaginal intercourse, it's unlikely that you will get a sexually transmitted infection. That is if both partners are being honest with each other, which unfortunately sometimes is not always accurate. So if you trust the person and you're sure they're clean and you have not had intercourse with someone, or oral or vaginal or penetrative, whatever, any sort of penetrative intercourse, that's unlikely that you're going to have any sort of sexually transmitted infection and you will not pass it or receive it from the other person. All right. Does finasteride cause sexual problems? Yes, it can. It is a very big cause of low libido in men. Please check out my video on finasteride and Flomax and how they can cause issues with sexual function. Make sure you check that one out because it goes over it in detail. All right. So there's a question here is tried Viagra and Cialis and had no success. What alternatives would you suggest? And so there after the as far as you think about the algorithm for treating sexual function, at least as far as what's approved in the guidelines, and there are things that people do off the guidelines, which I can talk about as well. But essentially, within the guidelines, if you as far as treatment options, you can try medications which are on demand, like sildenafil or tadalafil, which is 1 or 2 hours before sex. You take it, and then you have some after. When you're ready, you need some sort of stimulation for it to work. It's not just going to work on its own. If you're taking Viagra or sildenafil specifically, you need to take it on an empty stomach. And so, excuse me. So if you take it on empty, if you don't take it on empty stomach, it's not going to work well. So make sure you're doing that. Next thing you could try is a low dose of Cialis every single day, or tadalafil, 5 milligrams every single day. For some people, that works better. In fact, I really like that medication because it takes the stress out of needing to remember to take it an hour before. And then there's also vacuum erection devices. I've made videos about those, so check that out as well. And those are great options to help kind of force yourself to have an erection, basically, with a vacuum, and then using a band to sustain it in place. It works quite well. It just takes some practice and getting used to. And then there are intraurethral suppositories, which are medications that you put in the P tube that can help get erections. I have not had much success with those in my practice, but certainly those are options available. And then lastly, there's injections that you give yourself. And before you guys freak out and tell me that's too crazy or too scary, it's actually not that bad. It feels like a little pinch. In fact, I've given them to patients in my clinic, and they kind of look at me and say, "Oh, you're done." Like, they don't even feel it. So it's really not as bad as it seems. It's more psychologically stressful, and they work very, very well. So definitely those are a great option. Unfortunately, insurance in the United States does not cover those, and so they can be quite costly. And then lastly, there are surgeries you can have, like inflatable prosthetics or things like that that can help you get erections. But those are usually a last resort if you've tried other things and there's nothing working for you. Okay. Gas station sex pills. So those typically, and you can kind of use this as a rule for any sex pill that works on demand. If it's working on demand, meaning you take it and you get an erection, that's probably has some sildenafil, tadalafil, vardenafil, any of those medications are actually in it. And so that's probably not a great idea to take, especially if you're taking any medication called nitroglycerin or nitrates that maybe go under the tongue if you have chest pain. That medication plus any of these other medications can actually cause your blood pressure to get very, very low and can be very dangerous. So we do not recommend that you take them. So generally speaking, if they work, that's probably why, because we found lots of medications that actually have lots of over-the-counter medications that actually have those ingredients in them, and that's why they work. So I would not recommend those at all. There are certainly some supplements that people use that have maybe some benefit, like L-citrulline or L-arginine. I've made a video about that. Ashwagandha has been shown to help a little bit. So those things can be helpful if you want to try something that's more of a supplement. But of course, always be sure that your supplements are, manufactured by someone trustworthy. Again, gas station pills, probably not the best place to get things that you need for sex. Okay, what else we got here? So do men who have low T experience reduction of penile size? So it's not the testosterone. So generally speaking, as people age, they can perceive a loss in penile size. And the reason for that is multiple things. One is that you can have a loss of blood flow to the penis because of other medical problems like high blood pressure, diabetes. So those things can kind of prevent blood flow from getting to the penis. And then that can cause generally, when you're getting good regular blood flow, you're getting regular stretching of the penis, regular erections. And so over time, that can cause problems and cause a reduction in size. Also, as people age, very often they gain weight. And when you gain weight, particularly in the area right above the penis, that can cover the penis and make it look shorter. And so those things taken together, and of course, if you're having issues with erections, you're not getting regular erections, over time, it can lead to what we call fibrosis or scarring, and that can also shorten the penis. So it's important, I think, if you want to preserve your penile length, is to stay healthy, exercise, and make sure you avoid getting things like high blood pressure and diabetes. All right. Lubricants to last longer. Great question. So there are lubricants specifically, there's more like delay sprays and creams that can help you last longer. Delay sprays are generally sprayed on the head of the penis before sex. They absorb pretty quickly, and then you're able to have intercourse. You should not have oral intercourse with them. And they work for some people, absolutely, and they can help you last longer if you are concerned that you are not lasting long enough. But make sure you talk to your partner about that and see if they're happy, because maybe they're not really bothered. So certainly talk to them and make sure that's something that you both want. So I see a question from a gynecologist about testosterone for low libido in women. So that's a great question. I don't typically do injections of testosterone for low libido, but in women, you can use 1/10 of a dose of topical testosterone for low libido. Off label, there is good data supporting it, although it is not on label. And so you need to discuss that with your patients, obviously get blood levels before and follow them for side effects. But it is something that you can use. I think I've prescribed it to one patient. Some patients do get nervous about taking it, but it is really just such a small dose that it really doesn't do much harm, and you can get it pretty cheaply if you're in the States using coupons. Like GoodRx.com has coupons for Androgel, which is a topical testosterone. What does it mean when a woman gets a UTI frequently? So when you get a urinary tract infection, there's a number of reasons that it can happen. But if you're getting them more than twice in 6 months or 3 times in a year, that's what we call recurrent UTIs. And so when you're getting recurrent UTIs, then we should investigate to figure out why that is. And it can be for a lot of different reasons. And so one, you want to make sure you're not using any spermicides when you're having sex, using condoms with spermicide, because that can predispose you to infection. You want to make sure that you're urinating frequently enough. You're not holding your urine for long periods of time. You want to make sure you're drinking enough fluid. It seems so simple, but just drinking more fluid can actually prevent recurrent UTIs. Adding 1.5 liters actually reduces the number of UTIs you get by 46%. So it's pretty impressive, in fact, the amount of reduction that can happen just by drinking fluids. And then some women can get them just after sex very commonly. And that's something that we talk about. As far as other ways to prevent them, you want to make sure there's no anatomic abnormalities. So sometimes we'll talk about, maybe do a cystoscopy, look in the bladder to assess for any abnormalities, or get a CAT scan or imaging to look at the kidneys to make sure there's no kidney stones. But if there's nothing else wrong, looking at the guidelines for the American Urological Association, typically what we recommend is, of course, drinking a lot more fluids, making sure you're using the bathroom regularly, making sure you're emptying your bladder well. So sometimes people are in a rush and they don't empty quick enough, or sometimes people actually have abnormal function of their bladder and they don't empty well enough. And then that urine that sits in the bladder acts like food for bacteria. So those are the key things. And then we can talk about doing prophylaxis, like either antibiotic or non-antibiotic prophylaxis. And in the guidelines, they recommend cranberry supplements. I've made a video about that in the past, but essentially cranberry supplements need to be 36 milligrams of soluble proanthocyanidins to work. So all the stuff you get over the counter is not super helpful. So I would recommend generally starting those once a day. There are other things that are not in the guidelines that sometimes work for people, like D-mannose, like Hiprex and methanamine, like probiotics for some people. So again, lots of different things that can happen. So Steve, thank you for the top chat here, and I'm doing great, thank you. And then what made me want to study this side of human health? So that's a great, I love answering things about my specialty, of course. So I decided to go into urology because I loved surgery. I thought I was surprised. I actually didn't expect to be a surgeon. I thought I'd be a medical doctor or a cardiologist or something, but I really liked surgery. I liked working with my hands. I liked being able to fix something right away, but I wasn't so enthusiastic about general surgery when I went on the rotation. So I then looked at the subspecialties of surgery, which include, for those of you who are not aware, things like orthopedic surgery, ophthalmology, ENT or eyes, nose, ear, nose, and throat doctors. And orthopedics. I wasn't really interested in orthopedics or and neurosurgery, and I wasn't interested in that either. So those were off the table. I went to go see an eye surgery and was like, this is not for me. Even though I think it's a great field, I just didn't like the surgeries. So I then decided between urology and ENT. I went to go see both types of surgeries. And I met with both types of surgeons, and I just really connected with the urologist I was working with. Thought they were such great people, and they were so happy. And I wanted to be happy when I worked. And I loved that we were doing robotics and very innovative. And so that's what really brought me into urology. And I'm so glad I made that decision. All right. So, is shockwave therapy harmful to the penis? Great question. So basically, shockwave therapy, I've made a full video about this as well. Please check it out. But basically, shockwave therapy is when using shockwaves delivered to the penis, they essentially cause vascular growth. So they cause blood vessels to regrow over time. And so typically it's given in doses over weeks, so like once a week for 6 weeks or so. I don't offer it in my clinic because it is still not approved in the guidelines, and so it's not approved as far as a treatment for erectile dysfunction. So it's cash pay. A lot of my patients can't really afford to pay for cash pay, and so we don't have it yet, although we may get it. And it has shown some reasonable success rates. It's not really harmful. You could get some bruising, but generally speaking, it's pretty safe. And what we've seen in the most rigorous data is that after a year, about 50% of people are seeing an improvement in sexual function that's sustained. So that's good. 50% is still good. But certainly right now, a big cost out of pocket to get that. And so if you have if you have mild to moderate erectile dysfunction, like you're getting some erections, but not all the time, this is probably a great option for you. If it's from vascular problems like high blood pressure, diabetes, then yes, this is a good option for you. If you have the disposable income. Why is urology so competitive? So, urology is competitive because it's got great people like me. So, urology is competitive. It really is. There's so many people who try to match in urology, and last year was a very competitive year. I think we matched around 70%, which is pretty low. And tips for matching is, of course, get to know the urologist in your program, get to know urologists around you. Get good letters from them. Make sure you perform well on your sub-internships. And then, everything else that goes into it, get involved in research. It's super helpful. I'm always willing to help students who are trying to get into urology. So reach out to me. I'll do the best I can, link you up with a project or something. But yeah, it is competitive, but just be yourself and work hard, and you got to kind of take a leap of faith when you're doing something competitive, but it's absolutely worth it. Because I was not the best applicant, I will tell you, when I applied, but you end up where you're supposed to be. And so I think it's valuable to try and go for it. All right, let's see. And I'm sorry, guys, if I can't get to all your questions. It's just fast and furious over here. um, so let's see. Okay. All right, let me go back up a little bit. So there's a comment here about nightfall, and nightfall is essentially nocturnal emissions at night when you're having ejaculations at night. This is completely normal, nothing to worry about, and really nothing you can do to control it. Certainly, it happens more frequently if you haven't ejaculated during the daytime. Often, your body will take care of it at night. And so, really, nothing dangerous, nothing to be embarrassed about, completely normal. It happens all the time. And so, please don't stress about it. Okay, there's a question here about vulvodynia versus vaginismus. So that's a good question. Vulvodynia versus vaginismus are two different problems that can cause pain with sex, or pain in the vagina, or pain in the pelvic region. And so vulvodynia is like a catch-all phrase, which means pain of the vulva. And the vulva is essentially the entire with the vagina, inner, outer lips, clitoris, urethra. That whole thing is the vulva, as well as the mons. And so vulvodynia is like a catch-all phrase. It's really just vestibulodynia. What was the question? Vaginismus is a type of vaginismus, and vaginismus is essentially when the pelvic floor muscles tense when something enters the vagina, and that is essentially can be very, very painful, even to put a tampon in or to put a penis in, and that usually typically is treated with pelvic floor physical therapy, learning how to relax those muscles. There was a question about having a stone removed and then having consistent pain a week later in the head of the penis. So this brings up a good point. The head of the penis is my parents are texting me, telling me I sound sick. I'm okay. Thanks, Mom and Dad, for listening. So sorry. The head of the penis, when that hurts, it can actually be a sign of bladder spasms. And so bladder spasms, they happen when you have any sort of stent. Potentially, this person had a stent in their urethra, in their ureter, or they had a recent procedure, and that can cause spasms of the bladder, and that can radiate to the head of the penis. So that often can be a sign of that. So if you're having consistent, like intermittent pain at the head of the penis, that might be why. All right. My favorite ice cream flavor. Well, it's variable. I would say, what is my favorite ice cream flavor? I don't know. I like all types of ice cream. I'm a huge fan of ice cream, but I usually like kind of unique flavors, like things with lots of stuff in them, like peanut butter cups and chocolate and things like that. How long have I been in practice, and what are some of the biggest challenges? So this is probably a few more minutes, and then I'm going to sign off, but I've been in practice for about 4 years now. Some of the biggest challenges, I think, are really when you see patients and you realize we don't have enough to help, or you try everything that you can to help them and they're still not getting better. And that's really the biggest struggle I have, because, I really want to help everybody. So it's always sad when I can't do that. So that's been the biggest challenge, I think. And then just having, when you operate, you're going to have complications. Everyone does. And it's sad when that happens. So that's really it. So probably last question here I'm going to take. Here's a great question. So your son is uncircumcised, tips for hygiene. So tips for hygiene: when you take a shower, they should pull back the foreskin, clean around the head of the penis gently. They can use their finger. They can use a really gentle soap, but you don't need soap, really just water, and just a gentle clean is great. Make sure you do that once a day when you're in the shower. Dry it. It's really important to dry it afterwards, because otherwise the water can get stuck in there and be uncomfortable. And then when you pee, of course, going to jiggle, make sure no pee gets stuck underneath the foreskin as well. But really, that's it. You just want to make sure you gently wash it, really gentle, and dry it. I've made a video about this particular topic, so make sure you check it out. And there may be some more tips in there. All right, guys, thank you so much for those of you who joined me. I really appreciate it. And I hope you guys have a wonderful weekend, and I will have a video out for you on Monday. Bye.